Good morning, good afternoon, good evening, depending on where you are joining us from. We are delighted to have you here. My name is Patience Dabula. I work for the ASLM in the EQA project. The One Health approach championed by the World Health Organization, the World Organization for Animal Health, and the Food and Agriculture Organization emphasizes that the interconnectedness of animal, human, and environmental health is very important to all of us. This is particularly relevant when antimicrobial resistance as antibiotic use in animals can continue and contribute to the emergence of resistance pathogens that can be spread to us as humans through zoonotic diseases. We all know that external quality assurance is used by many countries, providers, and funders to check the performance of laboratories and the quality of results that are coming from the laboratories. This is very important also as it assists everyone to strengthen the surveillance for AMR in all the systems that are available at different sectors, because once we know that the quality of the results that are coming out are acceptable and okay, we can then trust the results that we are seeing and know that the surveillance that are done are correct. In today's SLM AMR Community of Practice Echo session, we'll be looking at key considerations for integrating One Health in EQA programs, and this session will be 1 hour. We will start with a poll immediately when I finish before Dr. Govender starts, and then we will allow her to do the presentation, and thereafter we'll make time for some questions. We encourage you during this time to then look at the chat box and also then put in some comments, and we have some colleagues with us that will assist with some of the questions as well. Please note that we have simultaneous language interpretation from English to French that can then be accessed via the interpretation icon at the toolbar. So if you are, whatever tool that you are using, if you look at the bottom, you'll be able to see interpretation. Please choose English or French, depending on the language that you prefer to use this time. I'm so glad, and it's a privilege to start by saying thank you, Vashnee, for agreeing to do this presentation. And I'm happy that you are here and we are all able to start. Dr. Govender is from South Africa. Dr. Vashnee Govender is a veterinarian and field epidemiologist. She's currently appointed as a lecturer in veterinary public health at the Faculty of Veterinary Science, University of Pretoria in South Africa. Her research focus is in One Health and antimicrobial resistance, with a special interest in the public health impact of antibiotic use in animal production systems. She's completing a PhD in collaboration with NICD in South Africa, looking at poultry production systems. She has previously served in many committees, among others, the South African Ministerial Advisory Committee for Antimicrobial Resistance, the Southern African Society for Veterinary Epidemiology and Preventive Medicine, and the South African Veterinary Council Food Safety and Security Committee. And currently, she's an active member of the newly formed Technical Advisory Committee of the EQA Africa, that's Fleming funded, being led by ASLM in collaboration with 3 partners. And our consortium partners are NICD in South Africa, in the east part of the continent, AMREF Health in Kenya, and for Central and West African countries, IPD in Dakar, in Senegal, is then responsible for that. And I'm glad that we are about to hear from the guru that understands the fields across. Can I ask you then to start by going to the poll. Dr. Govender, we are glad immediately after the polls, we will then start with you. So please help us in answering this question. Antibiotics that are used to treat infection in people are also used in plant and animal production systems. Please respond. True or false? The second, oh. Some of you are already even answering the second question that says people can be exposed to antibiotic residues from water resources as well. We have 59 people, 41% of you have already responded. Let's wait for more. The second question is saying people can be exposed to antibiotic residues from water resources. I have 60% of the participants having responded. I'll close the poll soon. %, we are almost there. Thank you. I guess we can then be able to immediately see that majority of you say that yes, antibiotics that are used to treat infections in people are also used. 81% is a good number. So we'll hear from the guru herself. The answer is true, of course. The second one is saying that people can be exposed to antibiotics from water resources. You also said true, 95%. This is good. Can I then hand over to you, Dr. Govender? And let's hear whether we were correct or not, and if we were, how did we fare? Vashnee, are you okay to start?
Yes, thank you, Patience. Can you hear me?
Yes. I'll wait for you then to share the slides, and then I will mute thereafter.
Sure. So thank you very much, Patience, for the very kind introduction and for this wonderful opportunity to present on this topic, which I'm very passionate about. So we have decided to start off with this quiz just as a way to introduce you to some of the concepts that we're going to be talking about during this session. So I'm just going to share those results with you. And to those of you answering true for all of them, well done. So this is indeed the case that, yes, antibiotics that are used to treat infections in people are being used in plant and animal production systems. And certainly people can be exposed to these residues from water sources. And of course that these organisms can be transmitted to people from the food that we are consuming. So I'm going to get straight into the presentation now. Great, thank you. Okay, so now that we have a better grasp of the interrelatedness of the One Health sectors, let's look at the topics which will be covered during this webinar. So firstly, we will look at what exactly is One Health and what are the underlying One Health links in terms of antimicrobial resistance. Next, we will look at how antibiotics are used in the agricultural sector for livestock and plant production. Then how antibiotic use plays a role in food security and food safety. eventually leading to how antimicrobial resistance surveillance programs could be designed from a One Health perspective. And finally, the role of proficiency testing programs in integrated AMR surveillance. So please remember to include your questions on the channel if you have any, and we will also be responding to them live where possible. So let us begin with the concept of One Health and the role players. So there are various structures and definitions for One Health globally, which has led to the international quadripartite organizations being the World Health Organization, the World Organization for Animal Health, the United Nations Environment Programme, and the Food and Agricultural Organization of the United Nations. So the quadripartite collaborate to drive the change and transformation which is required to mitigate the impact of current and future health challenges at the human-animal environment interface. And this is at global, regional, and country levels. And this has led to the development of the One Health Joint Plan of Action. So the One Health high-level expert panel acts as a scientific advisory committee on One Health matters to the quadripartite and specifically provides guidance on the One Health Joint Action Plan. So according to OLEP, One Health can be defined as an integrated, unifying approach that aims to sustainably balance and optimize the health of people, animals, and ecosystems. So it recognizes the interdependence of the health of these sectors and the multidisciplinary collaboration at various levels of society to address key issues, including clean water, energy and air, food safety and food security, and climate change as these matters relate to sustainable development. Okay, so now we can move on to the One Health links in antimicrobial resistance. So these links in these sectors can be quite complex. This figure represents a type of systems map which highlights the various mechanisms and transmission routes of resistant microorganisms, resistant genes, and residues. So at the center, we have antibiotics being used here in the aquaculture industries, in crop farming, and in animal production. So if the prescribed withdrawal periods are not absorbed for animals, people can potentially ingest residues from dairy, egg, and meat products. So that is, that is through this route, through food, that humans can then come in contact with these antibiotic residues. Similarly, antibiotic residues may also be present in fruit and vegetables consumed by people. These residues in plants may also enter the apiculture industry and can be then found in honey products. Residues may also contaminate environments from improper disposal methods of antibiotics and effluent from human settlements and hospitals, as well as runoff from livestock areas and aquaculture activities. So resistant bacteria can be transmitted to people through the environment, and resistant pathogens and bacteria can accumulate in these wastewater treatment plants. Yes, so antibiotics that are used to treat infections in people are also used in agriculture to control plant and animal diseases. And this results in increased animal growth rates and crop yields. However, it also creates a selection pressure for resistant microorganisms. And you've seen that resistant bacteria can be transmitted to people through shared environments, such as the soil, air, and water, direct contact with animals, including pets that are treated with antibiotics, or from contaminated food products. So let us look at some of the examples for AMR as a One Health issue. So these transmission mechanisms can be demonstrated by the following research examples. So we will start with animals. ESBL producing E. coli and MRSA strains have been detected in a number of animal species and animal products. So this study highlighted the molecular relatedness of ESBL producing E. coli isolates from humans, animals, food, and environments in the Netherlands. The close human-animal ESBL AMPC gene similarity detected between human farming communities and their animals. So this included broilers and pigs. So this next figure represents the detection of ESBL producing E. coli in live animal species and meat products from these species, which demonstrates the spread of bacteria through the food chain. So you can see that these organisms were present in live animals and also in the corresponding meat products, although at a lower prevalence. So this next study concluded that acquired antibiotic resistance and superantigen genes of Staphylococcus aureus were widely shared between S. aureus lineages and between strains from different animal hosts. This figure from the European Union Summary Report 2021 to 2022 represents the detection of MRSA isolates in cow milk and various meat products from EU countries. So now let us look at examples of AMR in plant products. So these include the detection of resistant bacteria from various plant products and the effects of herbicide use on antibiotic susceptibility of bacterial pathogens. So the study conducted in South Africa highlighted the detection of multi-drug resistant E. coli in spinach from commercial supply chains. So the study also included water sources used for irrigation. And it was concluded that more than 40% of these E. coli isolates at retail level were multi-drug resistant strains. So this example is of a study that investigated the presence of resistant gram-negative bacteria in soil, irrigation water, and fruit and vegetables in Algeria. The study concluded that including fruit and vegetables, and those that are usually eaten raw, constitute a reservoir for third-generation cephalosporin-resistant gram-negative bacteria and multi-drug-resistant bacteria, which can be transferred to humans through food. The next study highlights biocides such as herbicides, which are more commonly used in plant production. This demonstrated the ability of herbicides to induce an adaptive multiple antibiotic resistance in Salmonella and E. coli species. So if we look at examples from environmental studies, some of them will include the detection of residues and resistance genes in soil and water. This study highlighted the detection of antibiotic resistance genes found in African aquatic environments. And these genes encoded resistance to sulfonamides, tetracyclines, beta-lactams, and macrolide classes of antibiotics. This next study highlights the health threats from soil clinical pathogens carrying antibiotic resistance genes, and they determined regions that should be prioritized to control soil antibiotic resistance worldwide. So interesting here was Australia seemed to have the highest concentration of saturation of antibiotic resistance genes. So based on these examples, it is apparent that agricultural activities play a critical role in global food security. The World Bank defines food security as when all people at all times have physical and economic access to sufficient, safe, and nutritious food that meets their dietary needs and food preferences for an active and healthy life. And according to the World Bank, agriculture has the ability to reduce poverty and improve food security for 80% of impoverished people living in rural areas across the world. So the Global Food and Nutrition Dashboard of the World Bank demonstrates the current food security status of regions worldwide. And it is quite clear that the African continent is the most food insecure region, which is why agricultural activity and productivity is so important in Africa. So low and middle income countries where food security is threatened usually have less rigorous food safety standards. Many households in lower income countries obtain food from informal markets and sellers. The lack of training and infrastructure to keep food safe and a lack of access to potable water can compromise hygiene practices during food preparation. So this includes refrigeration and adequate cooking. So the burden of foodborne disease in Africa is estimated to be about 27 times higher than that of Europe or North America. So the use of antibiotics in agriculture threatens the safety of food by the presence of biological and chemical hazards in the form of resistant foodborne bacteria and antibiotic residues. However, many producers argue that a ban on antibiotic use in agriculture will further compromise food production and food security in already strained settings. So let us consider how antibiotics are used in livestock and plant production. Antibiotics are applied to plant crops in small scale and commercial production systems to treat bacterial diseases. Direct application involves crop spraying through various modes, as you can see in the top two images. Oxytetracycline and streptomycin are the most commonly used antibiotics in plants. However, crops may be indirectly contaminated with antibiotic residues from fertilizers containing livestock manure. So even if manure is treated by composting and if resistant organisms are destroyed, antibiotic residues will still remain in these fertilizers that are applied to plant crops. Antibiotic use in animals. So antibiotics are administered to animals either prophylactically to prevent diseases from entering epidemiological animal units, or they can be administered metaphylactically to control the spread of disease to uninfected animals from infected animals in epidemiological animal units, or antibiotics may be administered therapeutically to treat diseases in infected animals. In addition to these administrative routes, antibiotics can also be used as growth promoters to improve the feed utilization of animals. About 70% of the global production of antimicrobials are consumed by the animal health sector. And the vast majority of these antibiotics are administered to livestock via food and water. The World Organization for Animal Health recognizes the threat of the use of highest priority and critically important antimicrobials in animals on human health, and acknowledges the need for responsible use of antimicrobials across all sectors. So the 8th report on the global use of antimicrobials in animals was published just last month. And this report represents data from 152 WOA member countries. So from the report, the tetracyclines were most commonly used in 36 of the reporting member countries. Other common antimicrobials were penicillins, polypeptides, and the macrolide classes. So the highest distribution of antibiotic classes were used in terrestrial food-producing animals, next followed by companion animals, and fewer classes were used in aquaculture species. Although the aquaculture industry is one of the major consumers of antibiotics. So the use of antibiotics for growth promotion were reported across all WOA regions. And as you can see, Africa was so as you can see that Africa here was the 3rd highest region for members using antibiotic growth promoters, following the Americas and the Asia and Pacific regions. So of the 35 member countries that reported using antibiotic growth promoters, 23% reported using fosfomycin, colistin, and enrofloxacin. And these antimicrobials appear on the World Health Organization medically important antimicrobial list. So in terms of global trends in animal antibiotic use, this report represented antibiotic use in 65% of the global animal biomass for terrestrial and aquatic food-producing animals. For the period 2019 to 2021, only the African region reported a substantial increase of 179% in antibiotic use. However, the increase did not significantly impact on the overall use, since Africa only represents 10% of the global animal biomass and only 2% of antimicrobial quantities utilized worldwide. However, of concern is that half the member countries reporting the use of antibiotic growth promoters lacked regulatory frameworks, and 76% had not conducted the prescribed risk assessments on the use of antibiotics as growth promoters. So it is quite apparent that antibiotic use in agriculture results in the selective pressure for the intrinsic and extrinsic development of antimicrobial resistance. The transmission of resistance beyond agricultural production systems is undeniably a public health concern. So this has been recognized by the quadripartite organizations and has led to the launch of the Antimicrobial Resistance Multi-Stakeholder Partnership Platform. The platform aims to catalyze a global movement for action against antimicrobial resistance by fostering cooperation between a diverse range of stakeholders at all levels across the One Health spectrum. So the platform emphasizes the need for antimicrobial resistance surveillance. So globally, AMR surveillance in the human health sector is generally well coordinated through programs, specifically the WHO Global AMR Surveillance System. This level of coordination, however, is lacking on a global level for the animal health sector. So where veterinary AMR surveillance is in place, the systems are not always integrated with medical and food safety surveillance systems. So this is an example of AMR surveillance in the European Union, and for the period of this report included Salmonella and Campylobacter in humans, certain animal species, and food products. And from the surveillance data for the past 7 years, there was a reduction in AMR in food-producing animals in several of these EU member states. So the value of integrated surveillance really cannot be underestimated. So if we're considering integrated AMR surveillance, antibiotic resistance surveillance is determined by antibiotic susceptibility testing of bacterial isolates, but this should be integrated with surveillance on antibiotic use as well as on antibiotic residues. And these surveillance components should ideally span across human, veterinary, environmental, and food safety sectors. So in November last year, this commentary article was published highlighting the burden of AMR in Africa and some of the crucial steps to combat AMR on the continent. So these steps included greater investment, advocacy and stewardship programs, and the development of diagnostic tools and new antibiotics. So the crucial steps, particularly on the development of new antibiotics and diagnostics tools, are practically superfluous without the implementation of integrated AMR surveillance and proficiency in diagnostic capacity. So current resources must be capitalized on across sectors, together with the development and identification of sentinel surveillance sites across the continent for these steps to be effective. And this is really where the EQ Africa program comes in. So the EQ Africa program was developed to establish regional capacity in bacteriology, external quality assurance, proficiency testing in 14 Fleming Fund priority countries in Africa. So the EQA PT service providers are AMREF for East Africa, IPD for West and Central Africa, and the National Institute for Communicable Diseases for the Southern African region. And the program aims to reinforce knowledge, skills, practice, and regulation around quality management systems in general, and EQA in particular. The program facilitates the implementation of quality standards for bacteriology testing and the achievement of ISO accreditation in reference AMR laboratories. So the 5th cycle for proficiency testing is currently underway for medical, animal health, food, and environmental laboratories in Africa. So EQ Africa is facilitating the development of diagnostic and surveillance capacity for integrated One Health surveillance in Africa. So if the problem of AMR is to be contained, we will have to move beyond surveillance. But this can really only be done once we have reliable and valid surveillance data to act on. And the external quality assurance proficiency testing programs, as an example, run by EQ Africa, is really vital in this regard. So in conclusion, some of the key considerations for combating AMR are as follows. So firstly, acknowledging that AMR is the quintessential One Health issue of our time and can really only be contained through a multidisciplinary approach. This involves capitalizing on existing resources for the implementation of truly integrated AMR surveillance, including antibiotic use data and antibiotic residues in environments and food products. So there are many labs already running this kind of testing, and these systems really need to articulate. Laboratory capacity and proficiency in bacterial, phenotypic, as well as molecular testing must be developed to support integrated AMR surveillance. And then valid and reliable surveillance data can then be used to conduct risk assessments and develop the much needed risk management interventions to combat AMR. So really, we must acknowledge the role of external quality assurance, proficiency testing, in laboratory evaluation of the efficacy of these AMR interventions. So these include new technology and antibiotic alternatives that are currently proposed, including the use of prebiotics, probiotics, phytogenic feed additives, and bacteriophage therapy. So finally, combating AMR through interventions supported by diagnostic laboratory capacity and One Health surveillance is critical for the achievement of many of these sustainable goals, sustainable development goals. I would really like to acknowledge the EQ Africa, the South African National Institute for Communicable Diseases, and the University of Pretoria as contributors to this presentation. And I would also really like to thank the incredible ASL team for the organization of this webinar, and to all of you for your attention. Thank you.
Thank you very much, Dr. Govender. We really appreciate your time, and we are grateful that you have been able to share. Like I was saying in the beginning, you are the right person to talk to us about animal, environment, and human, and how AMR is very important to all of us. As you are emphasizing how important it is for One Health approach for all of us, looking at your presentation, it becomes more and more important for us not to ignore other sectors and only concentrate in human, and those of us that are from animal health not to ignore then the other sectors and concentrate in our body, different bodies. We need to be able to work across different sectors as One Health is the way to go. I was also wondering whether we should then be able to run away from food or not. As you are presenting, my indication is that we just need to work together, because we can't then say we're running away from animal or plants, as we are seeing the importance of the work being done. As you are emphasizing the critical role that's coming through, we're able to see that integrated surveillance is the way to go, because without that, we will be having challenges and missing what is important. This robust data is essential for informed risk assessment and effective interventions. And I'm glad that you shared many publications, and I know that we can do more on this to especially showcase what's happening in our continent. And thank you for all the insights that you are then bringing to us. I want to take this opportunity to say as well, before we take the questions that are in the chat, that I'm glad that this presentation is successful and was done through Fleming Fund funding that allowed us to continue with the work. And ladies and gentlemen, I'm grateful that you took your time today to join us and be with us. I want to start by a first question that's coming maybe from my side to Dr. Govender, to say that, in your opinion, are there specific food that we should be running away from, or we might as well continue with our diets and monitor antimicrobial and know what's happening across the world, not only in our country, because food are being banned, moving across boundaries, and then the borders are porous and everything can run. The organisms don't know borders as well. Over to you.
Thank you, Patience, for that very loaded question, and I don't have a very straightforward response to you. But what I can say is that, yes, we know that these resistant organisms can be present in all of the food products, whether you're on vegan diets or vegetarian diets or omnivorous diets, you know. However, the risk of transmission, I would say, is low to almost negligible in most cases. But that being said, we do need further studies to evaluate the risk in transmission to very susceptible population groups. That has not been done. As we know, in Africa, we have quite an immune compromised population, and we're not really sure how these bacteria, resistant bacteria in food products might affect this population subgroup. So again, the need for integrated AMR surveillance here, you know, cannot be overemphasized. We can only act on what we know. So surveillance data is going to really help us out here. At the moment, there are no trade restrictions for resistant pathogens. However, there are control programs in place in various countries for antibiotic residues in various food products. So those requirements must be met for a legitimate trade for many of these products. But again, for resistant pathogens, there are currently no trade requirements for specifically antibiotic resistance pathogens. So surveillance here is really going to be key for us to truly understand the extent of the problem in our varying food products. Thanks.
Okay. There's a question from Gabaye. I'm looking at the time and also looking at the questions on the chat. There are not many. So I'm going to ask some of the participants to unmute and ask their questions because we have time, and then we can then be able then to maneuver the remaining time together. I'm glad that we are also getting more questions as I'm asking them. And the first question is saying, even though there's a lot of pathways there for the transmission of resistant bacteria and genes between humans, animals, and the environment, what would be the best way of transmission pathways be interrupted or mitigated, especially in those who are living in resource-limited regions? Over to you, Dr.
Sure.
Govender.
Thank you. I think one of the most important mechanisms here is to really reduce the use of antimicrobials, and particularly the inappropriate use. We've seen that antibiotics are being used as growth promoters in animals. We should really try and reduce this practice, if not completely eliminate it. And without compromising food security here is really going to require a lot of training for these producers in biosecurity measures. So often these antibiotics are being used prophylactically, you know, as almost an alternative to the implementation of biosecurity practices. So really, if we have good training and good biosecurity implemented for these producers, we can reduce the unnecessary and inappropriate use of these antimicrobials, which is really driving resistance. And then once again, with surveillance, if we survey what these pathogens, the extent of these pathogens are in environments and in foods, we can come up with targeted interventions to really reduce the transmission to vulnerable communities.
Thank you, Vashnee. Prof. Olga, can I ask you to unmute and then pose your question or comment?
Thank you. Firstly, thank you, ASLM, for organizing this session. Indeed, wonderful. Thank you, Vashnee. You made such an impact. And firstly, there is a comment, and then I will have a question. Comment is that I really need to advertise this, and I'm pleased that we managed to publish our One Health surveillance that we done with One Pig Farm. I sent a link of this publication. It just happened a few days ago. And it's a team and funded by MRC and Bill and Melinda Gates Foundation. So we had, so from that, there is a question that goes to you. We have a quite positive experience, firstly with that very big pig farm with a system in a place. So you, from your studies that you done, you had a small holding farms in a chicken, mostly in a chicken. So do you want to just highlight what is difference, why a transmission can be prevented using IPC program compare in those two holdings, small and big holdings, how IPC is important? From also reading from Denmark and Sweden, they actually emphasize IPC processes in the food production, which obviously also underline importance for food security. So just a comment on that, and hopefully that makes sense to you. Thank you.
Okay, thank you. So I think if I understood your question correctly, so those IPC practices are what we refer to as biosecurity measures in livestock production. So really, if we have good biosecurity measures in place, we're actually going to reduce the risk of infection of animals with diseases, and as well as improve the management of these animals, which makes them less susceptible to diseases as well. And if we have less diseases in animals, then we reduce the need for antibiotic use in these animals. So that's really what it's about, is that we can have healthy animals without the use of antimicrobials and without the inappropriate use of antimicrobials here. So that is really the role of IPC and biosecurity practices in livestock production systems. Yeah,
great. And just to add, when we look at the Ministerial Advisory Committee, there is and that is the reason why I'm adding this, there is a huge cost if you want to implement the food security, well, IPC in the food security. It's a huge cost. So just to emphasize that African region is actually showing quite high use of antibiotics, but obviously looking at everything, I can't say it's understandable, but it can be explained situation. Thank you.
Yes, thank you. It's certainly true. The implementation of many of these biosecurity practices will require investment in infrastructure, especially if we're considering access to potable water. But sometimes very simple things can be implemented to improve biosecurity on smallholder farms. Thanks.
There's a question from Sandeep, and it's a comment. I know that we can't go back to the slides, but Sandeep is asking if we could then repeat the information on antimicrobial used both in animals and humans. I think you missed something on that slide, but because we can't go to it, can you just, if you remember the slide, just try and maybe repeat the comment that you had on antimicrobial used both in animals and humans.
Okay, sorry, there was a lot of information regarding that, so I'm not very clear on specifically what the participant was requesting. What I did mention is that the majority of those antibiotic classes that are used in animals are used in human medicine, and we've seen that some of those antibiotics appear on the priority list of the WHO. So I'm not sure if that participant can perhaps clarify what specific information they were looking for.
Okay, thank you very much. We'll ask the participant to go to the same question and elaborate more. If there's more information needed, depending on the time, we'll see what can be done. There's another question from Wapu who says, please, can you shed more light on risk assessment for use of antibiotics as growth promoters?
Sure. So here, the World Organization for Animal Health advocates that where antibiotic growth promoters are being used, that a risk assessment should be conducted to ensure that these residues from these products, as well as the development of resistant organisms, are really not posing a threat to human health. So these residues and these organisms are not entering the food chain, or where they are mitigation measures that are in place to prevent this from occurring. But as you have seen that many of these countries, actually, I think it was 76% of those countries did not, in fact, conduct those risk assessments that were required prior to use of antibiotic growth promoters in livestock.
Okay, thank you. I'm still thinking whether I'll start eating tomorrow. Then there's a question. Sati, I see a hand. If you can unmute and ask your question, please. You are muted if you're talking. Are you able to unmute? Are you able to help us there? If not, I will take another question. Oh, yeah. Now you are unmuted. Let's hear.
Okay. So thank you. So my first is a comment. We've seen the data presented by Dr. Vashnee, especially in Africa, which shows that it's a very big problem. But we know that for us to generate data, which will be useful, especially in clinical management, and also to advise farmers that use these antimicrobials for production, we need, laboratory, bacteriology laboratories. And that is a big challenge in low-income countries. So I don't know what is the advice, because I think for us to adequately, reduce this burden of antimicrobials, there is need, for testing of these agents, so that appropriate, treatment will be advised for whether it's farmers or for clinicians, for proper, advice on treatment. So, and we know that this is a very big challenge. Most facilities don't have, bacteriology laboratories, and where they have, there is inadequate reagents and also facilities. So what will you advise in that regard? Thank you.
Yeah, absolutely. Thank you for those comments and for that question. So this is certainly a huge challenge in low and middle income countries. So this is why it's going to be so important for us to capitalize on what resources we already have. We have seen that, yes, there is going to be a greater investment in diagnostic capacity, but we really need to strategize on how we use what we already have and work on capacitating those existing laboratories so that we can really bring them into surveillance. So beyond just diagnostic capacity, there's also a lack of access to veterinary services in many regions of Africa. And this is why antibiotics are often easily accessible or freely accessible over the counter due to a lack of veterinary services in these areas. So in addition to improving diagnostic capacity, we also need to talk about access to healthcare and access to veterinary services in these countries as well, in addition to capacitating or investing in more laboratory capacity. Thanks.
As we are going towards the end of the session, I'll ask two of the questions on the chat. The first one from Tesfaye saying, what proportion of antibiotics is used in plants or crops globally? Is there information, a use of antibiotics in crops in Africa? Then the second question from Esther is saying, please, is there a documented sampling plan for AMR testing in food?
Okay, so just on the first question, there really isn't global surveillance for antibiotic use in the plant sector, to be honest. So nothing that I have specifically come across from any of the organizations. However, what I can say is that it seems that in many countries, the use of antibiotics on crops has largely been phased out. However, the most common antibiotics I did mention were the oxytetracyclines and streptomycin that is being used, although really not as much as what the livestock sector is using. But that being said, where farms are not practicing organic farming, we have seen that there is still the use of herbicides. And from those studies that I presented, you would see that herbicides also have the ability, the use of herbicides has the ability to induce antibiotic resistance in those organisms present. It's also difficult to estimate the use of antibiotics in crops because of the use of livestock manure and fertilizers that also contain these antibiotic residues. So, you know, inadvertently, these antibiotics are somehow ending up in these crop farms as well. So the simple answer here is not that I know of specifically surveillance of antibiotic use in plant crops. And patients, if you can just remind me of that second question.
The second question was is there, let me go back because I just went to the end looking for additional question. Is there a documented sampling plan for AMR testing in food? And maybe before you answer, I see some questions are now coming and we're towards the end. We may not be able to answer all of them, and we will try and put them in different communication platforms that we have as ASLM. And FITSAM has kindly also shared a screen that shows you where you can access the certificate. Vashnee, just as a reminder, is there documented sampling plans for AMR testing in food?
So there are some guidelines that are available from the Codex Alimentarius Commission. However, there is the promotion of countries developing their own national action plans, including surveillance and integrated surveillance. So there's no specific template that is available specifically for surveillance in food safety systems, but there are international guidelines for the development of national action plans.
Okay. I want to do something that is different, that those of you that are still available, we will probably continue for the next 5 minutes or so to take few of the remaining questions. But those of you that have to go, we started on time and I would like to finish on time. I do then appreciate your availing yourselves today. We are not going to be able to cover everything today, but I just want to indicate that in addition to the slide in the certificate, this was a wonderful session indeed. We really learned a lot. It's out of usual. However, it's important that we concentrate and look at One Health more seriously than we have been. So please look for future invitations for the next AMR CoPs. We have one next week, same time, on utilizing interactive GIS platforms for integrated solutions in AMR One Health and pandemic preparedness. So we're looking forward to seeing you there. And thanks to Fleming Fund for funding the work that we are doing. in many countries, and especially the work that is being done in ASLM. So if you have to go and can't wait for the next 5 minutes, enjoy your weekend. But I know that Dr. Govender is available just to take the last few questions. I will say goodbye again, but I didn't want to miss more participants because some have already dropped without saying goodbye to them. Vashnee, it shows that this was and is still an interesting topic and presentation. We will stop exactly at 5 past. The next question from Temi says, thank you for the presentation. What is the contribution of resistance that come from food chain in the resistance in human health? And Stanley is saying, we have antibiotics used on animals and can be used on plants.
Okay, so I'm not sure if I understand the second question very well, but on the first question, I think we know that the global incidence of foodborne diseases and bacterial foodborne diseases are really underreported. So we're not actually sure of the incidence, of the true incidence and prevalence of bacterial foodborne diseases, never mind those that are due to antibiotic-resistant organisms. So I would say, yes, that the contribution is grossly underestimated, and this is really why we need to integrate these surveillance systems.
Okay.
And the next one was about antibiotic use in animals and plants.
I understand it to say, are there antibiotics that are used in both animals and plants? I may be wrong. The participant will have to forgive us. Because of time, we can ask for clarity further on the question.
So oxytetracycline, certainly those are, that is the most used class of antibiotics globally in animals, and specifically terrestrial food-producing animals. Streptomycin is also one of the common ones used in plant production, and also used in livestock production, but not as common as penicillins or macrolides and the tetracyclines, for example. I hope I'm answering that question.
I also hope so too. What do you think about using medical plants as an alternative? It's getting more interesting.
I think as we're looking at resistance that's rapidly developing to many antimicrobials, and we're trying to preserve those critically important ones, there is certainly the need for looking into alternatives to antibiotics, and there are numerous phytomedicine studies that have been conducted that are very promising. And in addition to phytomedicine, the field of phytomedicine, there's also studies on the use of probiotics and prebiotic therapies as alternatives to antibiotic use, and these are also quite promising. And phage technology is also seeming to come up, but certainly a place for phytomedicine as alternatives to antibiotics in the future.
Oh, thank you. The future is looking brighter, if not scarier. And the next question, Semi is saying, the use of antibiotic as growth promoters is to improve metabolism and not as prophylactic. So what alternatives do you propose?
So I'm not sure if this is about alternatives for growth promotion, or if we're referring to alternatives for prophylactics here. But yes, certainly these are two very separate uses of antibiotics in animals, as I've highlighted. So antibiotic growth promoters have nothing to do with the prevention or control or treatment of diseases, used exclusively to regulate the microflora in these animals, and in doing so, actually improving feed utilization. So alternatives there would generally point to good health, selection, genetic selection for these animals that tend to perform better in terms of feed utilization. That is one of the ways that we can ensure that without using antibiotic growth promoters. Beyond that, I do not have much more research experience in alternative to growth promoters, but for prophylactics, certainly we can strengthen biosecurity on these farms so that we can reduce prophylactic use and also improve housing and management systems on these for these livestock producers.
Thank you, Vashnee. It's 5 past, and I promise that we will finish on this time. There are many questions on the platform, and they include how I was looking forward to now reading a question in French, and now our time is up. Some of the questions are, how do you access EQ Africa? Please go to the SLM website or type EQU Africa. You'll be able to get more information on that. And there are questions on ISO 17043. I'm glad and anxious that we will have to address that topic because many countries as EQA providers are looking forward to that. And ladies and gentlemen, once more, thank you for taking your time being with us. We thank the funds from Fleming Fund for the work that we are doing and also assisting us to do this webinar today. Dr. Govender, you are a star. Thank you. We really appreciate it. And to all of you who contributed, asked questions, I do apologize we didn't get to all of them, but I'm glad that we are here. We will see you next week in Lab CoP and AMR CoP as well. And from me, Patience Dabula, enjoy your weekend. Goodbye, good evening, good morning, good afternoon, depending on where you are. Signing out. Bye.